Well, good evening, everyone. My name is Les Smith. I'm with the Michigan Department of Environment, Great Lakes and Energy. It's my pleasure to welcome you to this evening's conversation concerning the Rothbury Drinking Water Well PFAS sampling virtual information session and Q&A. Before we get to our speakers of the hour, I have a couple of housekeeping slides for you if you're new to Zoom. On my next slide, wanted to just let you know that all of your mics are muted and that this webinar is being recorded for later viewing. And on the next slide, I will share with you that there's opportunities for you to communicate with our presenter and panelists this evening. You may type a question or any questions that you have concerning the information you hear tonight in the Q&A box located in the bottom of your Zoom control panel at the bottom of your screen. You may also raise your hand using the blue hand icon that's also located in the bottom of your Zoom control panel. And at present, we don't have anyone on the phone, but if we should have someone on the phone, I'll come back to that later. When we get to the Q&A portion tonight, I'll just quickly go over these reminders again for the housekeeping. And with that, I'd like to turn over the virtual microphone to Abby Hendershot. She is the district supervisor with the Grand Rapids District Office Remediation Redevelopment Division. Take it away, Abby.
Thanks, Les, and welcome everybody. Thanks for joining us tonight to talk about the Rothbury Drinking Well PFAS sampling. As we go through our slides tonight, feel free to type in questions into the chat. We will answer them all at the end, but if you've got questions as you're thinking of them, feel free to type them in, and that way you won't forget. Peter's going to be doing our slides. So Peter, if you can go to the next slide. So as Les said, I'm Abigail Hendershot. I'm the district supervisor in charge of the Grand Rapids District Office for the Remediation and Redevelopment Division of the Department of Environment, Great Lakes and Energy. Tonight, you will be hearing from, I'm going to give you a little overview of MPART and some of the actions that we've been taking around the state. Peter's going to talk with you specifically about the investigation activities that have been going on within RRD to investigate some of the drinking water contamination that we've been finding. And Lisa Fisher is going to talk with, she's from our Department of Health and Human Services. She's going to talk with some of the health aspects of PFAS. And then we will come back and review the website just briefly and talk about any questions and answers that you have. So we have plenty of time for questions and answers. Also with us today, though, I want to just mention a few other people that are also on the phone that'll be here for all of us to lean into. We've got staff from our Drinking Water and Environmental Protection and Health Division, as well as our Materials and Management Division, that both sets of staff are also here within EGLE to help answer, because this has been a very coordinated team effort on Rothbury, because this is intersects a lot of our divisions as well as our agencies. So part of that coordination has been coming out of our Michigan PFAS Action Response Team, MPART, which is a very unique multi-agency approach that was started as part of an executive order in 2019 by Governor Whitmer, and really helps us to do a statewide approach for PFAS, gives us a advisory body that's charged with doing a comprehensive approach among all of the agencies that are directed with protecting our natural resources and our environment. And that includes our, obviously our Department of Environment, Great Lakes and Energy, our Departments of Human Health, our agriculture, military installations, fire departments, commercial airports. All of those partners are at the table because they all have a piece of this response team. And so that really helps us to direct the implementation of the state's agencies very strategically and leverage all of our assets to be able to get a better result in the end when we're all working together collaboratively. Next slide for me, Peter. So per and polyfluoroalkyl substances, PFAS, is really what we're talking about today. So PFAS have one of the strongest carbon fluorine bonds, chemical bonds that we know of in our environment or in nature. And so this stuff is not, it's all man-made. It's not naturally occurring, but it's very highly stable. It repels water, oil, fat, grease. It was actually developed accidentally back in the late 40s. And we now have over I've heard 8,000 different compounds that are in use today that use PFAS. And so if Peter can take us to the next slide, I'll show you some of those. So we use these PFAS chemicals in all kinds of different things, from our aerospace industry to apparel. Think of the Gore-Tex, think of anything that repels water, Scotchgard on our carpet, Scotchgard in our paints, all those kinds of things. The aqueous film forming foam, which is also AFFF, which is used in our firefighting foams. And that's, really the best stuff out there to put out fires when it comes to petroleum, hydrocarbons. So all kinds of different PFAS uses across our society. Next slide. But what's the concern with PFAS, right? They can be found widespreadly through our environment, but they don't really break down easily. Once they get into our environment, they're harder to remove because they don't naturally degrade in nature. And so they can bioaccumulate. If we ingest fish that might have PFAS in them, they can bioaccumulate in our systems, and they're going to potentially have some health effects. We know that there's some health effects associated with PFAS. But we need more information. We're just on this cusp of this emerging science, and there's not always a lot of standards. We don't have any federal standards yet for PFAS. Go ahead to the next slide for me, Peter. So the other big challenge with PFAS is the fact that once it gets into our ecosystem, it does have a tendency to cycle through the whole ecosystem. So say, for instance, that PFAS containing waste was put into our landfill. As that landfill starts to break down, it produces leachate, which might have PFAS in it, which goes to the wastewater treatment plant for treatment. Their treatment systems don't address PFAS. They're not designed to address something like that. And so they may inadvertently discharge it to a stream, or they may inadvertently end up passing it through to biosolids, which then, could potentially get into food products or infiltrate into the groundwater. There's a whole cycle here. So we're using MPART to investigate and really dive into where's the best point in this ecosystem to kind of break this off so that we don't continue to put PFAS and have PFAS cycling through our ecosystem, but we actually have an opportunity to capture it or to control it in one location so that we can better, contain PFAS and the way it gets into our different systems and ultimately into our ecosystem and in our fish, our humans, all of those things. Okay, next slide. So one of the other things MPART's really taken a very active and aggressive role in is doing surface water investigations. We have gone around the state to do fish studies, to do river sampling, to look at foam, to look at wastewater that might be discharged to our surface water, to really investigate all of those aspects because some of our surface water is used for drinking water. So it's really important to understand the state of the levels of PFAS contamination that might be existing in our rivers or how clean our rivers are. So that was another important aspect that MPART has been doing and continues to do across the state. So the next slide. The other really important piece was the public water supply testing that was done. One of the first things once MPART was created was to look at all of the public water supplies across the state and test for PFAS. And that included, all the community water supplies. So think about, Grand Rapids, think about Ann Arbor, think about Detroit, all of those big cities that have municipal water for its residents. They were all sampled, they were all tested. The 17 different supplies for the tribes were tested, schools, the daycares, and all of it came back with some really interesting results. We also had 65 different systems that relied on surface water for drinking water. So out of those, we had 61 systems that were less than 10 parts per trillion. Okay, next slide. So out of the sampling that was done, the results were pretty good. We had 90% of the public water supplies that were non-detect. It didn't have any, traces of PFAS, but there were a couple that had some traces of PFAS. And in some cases, 3% of those systems actually had a concerning level of PFAS. And so actions were taken to remedy that situation. And so that's a really, again, another testament to the collaborative nature of MPART's action, being able to quickly assess and undertake action. So the next slide. So drinking water standards, one of the, when MPART first started in 2017, 2018, we didn't have any drinking water standards for public water supplies. And even at a national level right now for EPA, we do not have any overarching drinking water standards for the country. So Michigan has actually put together its own drinking water standards, and that was based on the data that came out of a science advisory panel that was put together through MPART to look specifically at this issue. And their investigation and information into the science and the toxicology for PFAS determined that really the 70 parts per trillion that was being used at that point as a lifetime health advisory through EPA was really too high. They considered that we should look at additional PFAS levels and look at making it lower. So the two-step approach then was to use that science advisory work group to give us health-based numbers that were going to be protective for Michigan residents. And ultimately those health-based values then were then promulgated into standards through the rules. All right, next slide. So what that means is for drinking water, public water supplies, where you have a big municipal system, they have what is called an MCL, a maximum contaminant level, which went into effect as a state drinking water level on August 3rd of 2020. So just a few months ago. And that made these 7 compounds here as new drinking water standards for those municipal supplies. And that was a big day. So that gave us the PFOA at 8 parts per trillion and PFOS at 16 parts per trillion, which had up to that point been 70 parts per trillion combined. So these are lower, more conservative numbers in an effort to try to protect public health. Next slide. Didn't necessarily mean, so one of the things that we do in our world is an MCL doesn't necessarily mean it's a cleanup criteria. The MCLs are directly applicable to public water supplies, like the supply at the Green Lawn Mobile Home community. It doesn't necessarily apply to somebody's residential drinking water well. In the case where you have contamination in a drinking water well, that then comes under what we call cleanup criteria. And so those 7 MCLs don't directly relate, but we do have cleanup criteria that are used for residential drinking water wells at 8 and 16. So 8 for PFOA and 16. And the other 5 compounds that were in that previous list are on their way to becoming cleanup criteria as well. So that's kind of a side note on some of the other things that are going on. Next slide for us, Peter. So what this all means when you get these standards put together is that between the last 3 years of MPART's work, really aggressive work throughout the state to sample all the public water supplies, to sample all of the surface water, and then to start looking closely at some of our obvious sites of contamination, what we've really found is that at this point we have about 151 locations across the state where we know that there's PFAS contamination, and we have investigations that are ongoing to try to understand those sources, understand if we've got anybody being exposed, protect that drinking water pathway. And it's not that this map might look a little bit scary, but realistically, Michigan is so far out ahead of the other states that the other states haven't even started looking, where Michigan has actually started looking and has a pretty good handle on what's going on across our state. So these dots here actually represent a whole bunch of different investigations, and that might include drinking water or surface water or soils, or it depends on the investigation. So next slide for us, Peter. The last part is that MPART also has a citizens advisory work group. And so the last piece to MPART is that we have an opportunity for citizens who might be, largely affected by PFAS to actually engage with us, to have a voice at the table with our regulators, with us at the government level, to be able to have some input, to show us how to engage and empower communities to have a voice at the table, help us to show us how to educate the general public so that they understand PFAS and the potential risks. And so that's been a really key part of this, is to have this citizens advisory work group, because they've been advising MPART now for over a year, and those work groups are out on the website and anybody can join. So that's something that if you're interested, we'll have more information for you at the end. I think, whoops, next slide for me, Peter. So I think this brings us to, I wanted to give you a background on MPART and how this particular location fits into the greater picture of the state, and how MPART exists, and how this particular location was actually found because of a drinking water sample, which Peter started to investigate after getting those results. And so I'm going to let Peter talk to you about the site specifics, but I hope that gives you a good idea of how this all kind of came to be. So Peter, you want to take it away?
Yes, thanks, Abby. Hi, everyone. I'm Peter, the Eagle Project Manager for the residential well sampling portion of the investigation. Thank you all for tuning in tonight. Our sampling of the residential drinking water wells began after Eagle tested the water at the Green Lawn Mobile Home Court in Rothbury. And PFAS were detected consistently in that water. We realized that if one well was impacted, there could be other wells in the area impacted too. Right now, we're not sure exactly where the PFAS is coming from. We've looked through records and the site, and we've come through determined there's a couple potential sources, but none that really line up well. We don't have a lot of good information. And we're still looking, but there's a chance with some of these sites that the source or sources may never be known. Our focus right now is on sampling the drinking water wells to make sure that if anyone is being impacted, that we can find out and take appropriate steps to address that. So that's why we're sampling the residential drinking water wells. The mobile home court is being sampled as well by through the drinking water division. So for those seeing the map here, the orange box shows the current sample boundary. So the homes within that orange line are the ones that Eagle's been sampling the drinking water wells for. And if anyone can't really see the map well, the current sample boundary is east of South Michigan Ave and west of Bartlett Road with the bike trail there, south of Winston Road and north of community street where the village hall and the playground is there. And this sample area was determined based upon groundwater flow information that Eagle had. And when we talk about groundwater, we're talking about the water in the aquifer underground. And that's the water that people would be drinking from their wells. So the groundwater flow in this area is generally from the northwest, but it can be vary a little bit more to be from the north or west, depending where exactly you are, how things are curving. So that's how we established this initial sample area. And so if you live within that sample area and you have not been sampled, please contact me so we can arrange sampling for you. My phone number is 616-439-8019. I'd love to talk and get the sampling arranged. We've been collecting samples from outdoor spigots, so the samplers don't need to go into your house, and the sampling is free for the homeowners within this sample area. So far, we've sampled the water from 13 homes starting in late September. Looking at this map here, this kind of depicts the residential drinking water well results. So if you see a red dot, that's above the maximum contaminant level, kind of the safe, acceptable level to drink. Yellow means that some PFAS were detected, but they're below the standard there. And green means that there were not any detections of any PFAS. So of the 13 homes we sampled this fall, 4 had detections of 1 or more PFAS compound above an MCL. The max PFOA concentration was 25 parts per trillion. And as Abby said, the criteria for that is 8 parts per trillion. And the max PFOS concentration we detected was 44 parts per trillion. And the criteria for that is 16 parts per trillion. 5 homes had the detections lower than the criteria, and 4 did not have any PFAS detected in their samples. One important thing to note is that PFAS contamination often seems to travel in a relatively narrow depth interval. And this matters because if there's 2 homes that are equally in the path of a contaminant plume, one might have a well that's screened where that well is sucking in the water right in the depth of that's contaminated, and one might be lucky and have a deeper screen and be drawing from clean water below. So you can really get different sample results from 2 homes right next to each other, really depending on where those wells are screened. Our sampling so far shows that the PFAS contamination is not just limited to the mobile home court, but unfortunately, the contamination is impacting a wider area. So District Health Department number 10 and the Department of Health and Human Services are offering filters to any home sampled by the state with detections of PFAS, so they can install that on their sink and have clean water from there. And based upon the results of this initial sampling that we've done, Eagle has begun the process to expand the sample area to include more homes and businesses. So the next step is to sample some additional homes and businesses with drinking water wells to the west and north, and that's being driven based upon these residential drinking water well results that you see here on this map. So the sampling will likely take place here in later in the winter or maybe early spring. And if you have any questions after this presentation that aren't answered, or you don't feel comfortable answering or asking over this meeting, feel free to contact me, and I'm more than happy to talk. So up next is Lisa Fisher, who is a toxicologist with the Michigan Department of Health and Human Services, and she will talk about the health effects of PFAS.
All right, thanks, Peter. Let me see if I can get my video working here.
We can see you, Lisa.
Oh, okay, good. Okay, yeah, so my name's Lisa Fisher. I'm a toxicologist with the Michigan Department of Health and Human Services. And I'm just going to talk a little bit about some of the health effects associated with PFAS and then what role MDHHS has in PFAS investigations. So MDHHS works alongside the local health department. So in this case, it's DHD 10 or District Health Department 10. And our goal is to understand the health concerns that are facing your community. And we kind of let Eagle lead the site investigation and collect the information. And then we and DHD 10 lead the public health planning and response actions based on that data. And based on the data, we either will offer some recommendations if public health actions are needed, or let people know that no public health actions are needed. And so Abby kind of touched on this at the beginning. You know, PFAS are found in a variety of household products, and there's many different ways that people can be exposed to PFAS chemicals. And one of the main pathways is through drinking contaminated water. So that's why there's such a focus on drinking water with PFAS. Some other ways that people can be exposed is if they're eating fish that are from water bodies contaminated by PFAS. If you go to the MPART website, there is a tab on there for fish, and it'll give you all of the Eat Safe Fish guidelines that we have across the state that are related to PFAS specifically. Some other ways that people can be exposed to PFAS would be accidentally swallowing contaminated dirt or soil, eating food packaged in materials that contain PFAS, use of consumer products, and then PFAS absorption through the skin is typically not a concern. There are a few areas across the state where we have issued some advisories to avoid foam that's on surface water like lakes and rivers because it may contain high levels of PFAS. But in general, PFAS absorption through the skin is typically not a concern. All right, and this is a graph that shows the blood levels of some different PFAS compounds in Americans from the years 2000 to 2014. And what's kind of interesting about this graph, that top line shows the levels of PFOS in blood. And you can see that from the years 2000 to 2014, it's really gone down dramatically. And what's interesting about that is that in the year 2002, manufacturers could, you know, they started phasing out the production of PFOS and PFOA. So we've seen a pretty remarkable decrease in blood levels of PFOS from 2000 to 2014. So the reason why we're concerned about PFAS is because there are some associated human health outcomes with PFAS exposure. And we know the most about two specific PFAS compounds, the PFOA and PFOS. So these are some of the health effects that are associated with PFOA and or PFOS. And I'll just read through them in case anyone can't see the screen or is on the phone. They include lowering a woman's chance of getting pregnant, increasing the chance of high blood pressure in pregnant women, increasing the chance of thyroid disease, increasing cholesterol levels, changes in immune response, and for PFOA, an increased chance of cancers, especially kidney and testicular cancers. So MDHHS uses multiple lines of consideration when we're determining whether certain public health response actions need to take place. So one of the main things that we look at are the PFAS results from the residential well sampling. So we look at the individual samples results as well as the results taken collectively from the entire investigation area. And we compare those results to the MDHHS comparison values, which I'll talk about on the next slide. And then we also take into consideration any site-specific information that helps us determine which public health response actions may be appropriate for the site. So the MDHHS comparison values are the lowest of two different public health or health-based screening levels. That includes the MDHHS public health drinking water screening levels and the MPART health-based values, which are also known as the maximum contaminant levels. And because these are both health-based screening values, they're set to protect everyone, including those that are most at risk of harm to their health, which for PFAS is fetuses and breastfed babies. And then this just shows what the MDHHS comparison values are. And you can see that for all of them except for PFOS, they're exactly the same as the MCLs that just went into place in August. The only difference is for PFOS, we have a comparison value of 8 parts per trillion, whereas the MCL is at 16. So this picture kind of shows what we do when we look at the residential well results. So, you know, we're looking at your individual well result, but we're also looking collectively. So you can see on the left, there's a yellow house in the middle, which means it does have some PFAS, but it's less than a comparison value. And it's surrounded by a bunch of blue houses that don't have any detections. So in that instance, a lot of times our public health response would be different. You know, we might not decide that, and it depends on different factors too. But, you know, we may say that they don't need a filter or alternate water. Whereas if we look to the right, we see this house that has, you know, it's the same level. You know, they have some detections, but they're not above a comparison value. But they're surrounded by a lot of houses that do exceed a comparison value. And so that's kind of the case that we have here in Rothbury, where, you know, some houses have exceeded one or more of the comparison values, and those houses have received point of use filters to go under their kitchen sink. And then, you know, maybe right next door is a house that has some detections of PFAS, but they don't exactly, you know, exceed that comparison value. In that case, we do want to provide those homes with filters as well, just as a precaution. You know, as the investigation is ongoing, in case there's any fluctuations in PFAS levels, we want to just make sure that those people are protected as well. So I also mentioned that we take into consideration any site-specific information that Eagle has gathered. So whether there's any known or potential sources in the area, what the geology is, and then the direction and size of any groundwater plumes. And so based on all this information, you know, so both the residential well results and then any site-specific information, we may decide that there's no public health actions that are necessary. In certain cases, like this one, we've recommended the use of filter for anyone in the area who had any detections of PFAS. And this is just an interim or a short-term solution while the investigation is ongoing and we can come up with a permanent solution. And it provides residents with a level of protection from any potential fluctuation in PFAS levels while the investigation is ongoing. And then we also provide some education material in our results letters, and it just provides some more information about PFAS in drinking water. And I'm going to turn it over to Tom, who's with DHD10. Do we have Tom?
I think Tom was on. Can you hear us, Tom?
Yep, I've got you.
There we go. Thanks. Whoops, you just muted yourself. Okay, Tom, we can't hear you yet, but if you can unmute yourself.
Okay.
There we go. Thank you.
Hey. As a local health department, district health department number 10, we really act as assistants between the two state agencies. Since we have local staff, we can also often be used as the, boots on the ground to help with whatever work needs to be done. As Lisa has stated, any of the homes that tested out with above the MCL, the maximum contaminant levels, we did provide bottled water for them. The bottled water was only for drinking and cooking purposes. We're not concerned about the absorption through the skin, so we're not worried about showering or laundering or anything like that. The bottled water use is really meant as a temporary condition until we can get the filters installed. The filters that we use have been certified by the National Sanitation Foundation as being able to effectively remove PFAS. We do have a licensed plumber that we have install the filters. And we're as once again, as Lisa had mentioned, we do use the filters for anyone who has any PFAS within the water, just not those exceeding the MCL. So presently, I believe we have 8 homes that we have filters in, and we'll be providing them for a 9th one. Once again, the filters are meant as a temporary solution until we can find a longer term solution to ensuring that the water coming out of your faucet is safe.
All right, thank you, Tom. So I will come back on. All right, can you see me? There. All right, so thank you, Tom. Thank you, Lisa and Peter. So as we promised, we've got some good questions here to throw out to the group for answering, but we wanted to take and show you the Michigan PFAS Action Response Team website real quick. So Peter, I think has got that queued up and is going to be ready to go, just because it's got a vast plethora of information and resources here right at a click of a button. So Peter, if you can.
Yep, just a second here while I pull it up.
Okay, excellent. So it's really easy. Literally, you can type in MPART into your Google web browser, and this will come up. So Peter's going to click on the Investigations tab, and there's a little drop down there. You can do an area of interest, and those are the sites that are still under investigation. We're not really sure if we've got a source, but these areas of interest are, that's where Rothbury is. And so Rothbury was actually posted to the website, I think yet this week. And so you'll see that same map and a little blurb about the investigation. And then we will keep this updated with additional resources and additional, you won't see specific houses or specific results, but you're going to get a general maps about what kinds of detections we're finding and additional actions. So this is a really good resources for not only this site, but all 151 are out here on the MPART website, but there's also additional information on, if you've got questions on your personal well, or you've got questions on foam or anything else, there's a ton of information. Peter, anything else we were going to mention about the website?
No, I think that's good. I encourage people to look at that area of interest for Rothbury. It will be updated as information comes in, and then also just whatever other things you want to know about PFAS, that's a good place for information. So definitely encourage you to look there.
A lot of information. Okay. I think Peter's going to switch us back to the slide presentation. Peter, I think our first question is about the Green Lawn Mobile Home Community and the orange boundaries. So maybe if you want to bring back up your slide that had the outline of the sampling area, that would be great.
Sure, just a minute.
And then Les, I think you were going to chime in with some reminders for people who want to have a question answered.
Sure. Thanks, Abby. Just a reminder to everyone, just housekeeping, the ways to communicate with the team tonight. Some of you have already found that, and I'm glad you're using it. Keep the questions coming. For anyone that has questions, you can type them in the Q&A box located in the Zoom control panel. It looks like a little call out that you will see on a cartoon. So you'll see it at the bottom of the screen, and we've got questions coming in, so that's great. Also, if you want to verbally ask a question, you can raise your hand and we'll try to get you unmuted so you can ask your question out loud. And we have one person on the phone this evening. So for my caller that's on the phone, if you would like to raise your hand electronically, the way you do that is to push the star key and the number 9 on your phone. And that'll electronically raise your hand, and I'll see that here and try to get you unmuted so you can speak with tonight's presenters. So that's how you can talk to us tonight. Abby, it's back to you.
Okay. And Les and I will switch off on questions so you don't get tired of my voice. So we've got a question here, Peter, for I think for you. It says, it appears that Green Lawn Mobile Home Community is outside the orange boundary test area. Can you further elaborate on that observation?
Yeah, good observation. The Green Lawn well is being sampled through the drinking water program. I believe that's quarterly. So that is being sampled. The orange boundary is drawn to illustrate where the residential homes, so not part of the mobile home park, so individual homes where we're sampling. So the Rothbury well is being, or I'm sorry, the Green Lawn Mobile Home Community, that well is being sampled too. It's just not part of the residential drinking water well sampling that we're doing.
Okay, and that feeds right into the next question, Peter, which says, with regard to the 13 wells that were sampled, how often was each well sampled, and what, if any, additional sampling will take place in the future?
Another good question. So far we've only done one round of sampling. Several of the homes had a duplicate sample, so they collected 2 samples at once and ran them, and the results from those duplicate samples were really compared well. You got the same result with those duplicates. As far as additional sampling in the future, that's a possibility. At this point, it's a little bit too soon to say. Right now, there's been the health department's response to providing a filter with anyone with detections should be addressing anyone that we have sampled for now. And then our focus right now is expanding the sample area here shortly to include more homes and businesses that may be impacted. So there's a chance in the future we may circle back and sample some of the wells we've already sampled, but we're not at that point quite yet.
Okay. And I think, again, for Peter, you're getting all the questions. So you're getting the first set of questions. What do you mean by a groundwater plume?
Okay, yeah. So that's kind of the language we use for describing contaminated groundwater and how it moves. So if you imagine, this is probably I don't know if it's the best analogy, but you can think of how if you like poured oil on the ground, you could see the oil spreading out, right? So with contaminant plumes, we're talking about the groundwater flowing and that contamination kind of like the oil on the ground spreading out and moving with the flow. So the contaminant plume is the area of the groundwater that is impacted. And usually they extend out and travel with the direction of the groundwater flow. And they can extend with PFAS often quite far because it doesn't break down. So you can have a relatively long, narrow contaminant plume, so section of groundwater that's contaminated.
Mhm. And I will throw in, Peter, that it's really important for us in Eagle to think about that groundwater contamination in a three-dimensional viewpoint, because the depending on the geology or the type of formation that the groundwater is going through, the PFAS plume can, will actually change some size depending on what it's flowing through or around. And so we really have to take the investigation step by step to try to define where that plume is or isn't based on the actual data. So it's a very data-driven, science-based approach to these groundwater investigations. But there is a slide, Peter, if you want to go to that part of Lisa's slides that showed the outline of a groundwater plume. I think that was a pretty good visual for what a groundwater plume is.
Pull that up just a minute here.
Yeah. There we go. So that map there where it says plume actually shows where you might have a PFAS that might have been some sort of a contaminant that was dumped on the surface as it gets into the soil and then mingles with that groundwater. As the groundwater is traveling, as Peter was talking about, there's going to be that kind of pancake-ish type of flow out, where you're going to have high concentrations in the middle and lower concentrations on the edges. But depending on where your house sits within that plume, it's going to have a variety of concentrations across the neighborhood that may not always make sense. Your results may not line up with your neighbor's results. So, okay, I think we've got several more questions. So I will just keep plowing through these. I think this one goes to Lisa. When DHHS recommends a filter or a supply, does it provide those things or does Eagle?
Yeah, so we provide the funds for DHD10 to provide the filters to the residents.
Thank you. And then you can answer the next one as well. Why are you not concerned about dermal contact?
So we do have one of the MPART work groups. I believe they had a sub work group to look at dermal contact with PFAS. And I wasn't a part of that, but I do know that, the levels of PFAS have to be like way higher for dermal contact to be a concern than it would be through absorption through the digestive tract. So that's why we're more concerned about drinking water, is because that's where we're seeing levels that could be associated with some adverse health effects rather than dermal contact. So dermal contact really isn't a concern with the levels that we're seeing across most of the state.
Okay, thank you. I'm assuming though that if people wanted more information on that, there's probably some questions and answers like that out on the MPART website too.
Probably, yep.
Yeah. Okay, the next question I think we'll probably go back to Peter. Is Eagle engaged in any Part 201 enforcement against an actual or alleged polluter?
We're not at this point because we don't know where the contamination is coming from.
And I will say that, excuse me, if we have an actual known polluter that's still viable and in business, then yes, if we can identify that kind of a party or that kind of a situation, then Eagle would take, would have the obvious compliance communication with that responsible party to be able to encourage them to take those actions and to be able to do finish up the investigation and potentially take up any kind of necessary response actions to remedy the situation for the homeowners. At this point, we do not have that kind of information identified. We don't have any real known sources that we can identify at this point. So we're pretty early in the investigation stage, but we thought this was good information to get out to you guys before we got too far down the road. We've got a question on providing the link for the webinar, and Les, I think you can answer that one for me.
Yes, I can. All right, so following tonight's webinar, we will send the webinar out, the recording out to be closed captioned. And once we receive the closed captioning back, we will post the video on first initially on Eagle's YouTube channel. And then it'll also be placed on the Impart page as well.
And I think that, Les, that's the case with all of our PFAS town halls, correct?
Yes, all of our town halls are recorded and they're posted online in two locations, the Eagle YouTube channel and the Impart page.
Another reason to go to the Impart page. Okay, another question here. And I'm going to think that this would go back to Peter. Would it not make sense to sample the wells multiple times? Isn't it the case that the plumes are sometimes nonlinear and that they may not affect a well 1 month, but affect the same well a couple of months later?
Yeah, it certainly is possible. And that's why at some sites we have gone back and resampled. But that's also why the health departments are providing the filters if there's any sort of detection, because we don't know exactly how things might change seasonally, or different pumping conditions, things like that. So if there's any trace of PFAS in a well, that's why they're offering the filter. And so yes, we may circle back and sample, but right now we still want to focus on sampling people who haven't been sampled for the first time.
Mm-hmm. Mm-hmm. It's a proactive measure to give filters so that we have longer time to be able to do that sampling, to be able to do the investigation, so we can build the information and basis for some sort of a determination if we can figure out the source. All right, thank you, Peter. Is there any vapor intrusion concerns with PFAS? Peter, you want to answer that one?
No, there's not at this point.
Yeah, I don't think we've got enough evidence yet to talk about vapor intrusion concerns or just the information there that we would be able to know. As far as I know, there aren't any sampling methods for sampling PFAS for vapor intrusion issues, but talk to us in a couple of years, maybe that'll change. Have homes outside the orange boundary been notified of the situation? In other words, they could test their own wells if they didn't want to wait for possible bad news down the road.
Well, that's one of the reasons why we're doing this this webinar right now. We want to make as many people aware of the situation as possible. So certainly if someone wants to be proactive and sample their own well, that's definitely encouraged. And so if someone is listening here outside, or if you have friends outside the boundary and that might be interested, yeah, please let people know. And it's certainly encouraged. If you have a concern, you can go ahead and do that.
And I will just add that there are a number of different laboratories across the state that actually do PFAS drinking water sampling, or not sampling, but testing, including Eagle's lab. which I think is about $250 a sample to take and sample your own drinking water and send it into the lab for some PFAS results. So that's always a possibility. And again, that information is out on the MPART website. This caller or attendee is wondering if the creek is impacted, or are there any other surface water impacts? Who would like to take that one?
I can take it. As far as PFAS goes, we haven't sampled for it yet because, again, our contact is concern is primarily the residential or the drinking water wells. So if anyone's drinking it is our first concern. Down the road, there's a chance that the creek may be sampled. That just hasn't been the immediate priority. So that's the answer for PFAS. I don't know if anyone else on the line has any information about any other potential contaminants. But for PFAS, it has not been sampled yet.
And I'll just chime in here. I did talk to Water Resources last week and kind of put Carlton Creek on their radar for potential fish sampling next year. So I don't know if it'll specifically happen next year, but it's at least on their radar.
Fantastic.
Okay. Lisa, you can answer this next question. When bottled water is provided, where does the bottled water come from? And does the team that provides them have a contract with any of the bottled water companies for that water? How are they tested for PFAS?
This might be a question that Tom can answer. I'm not sure what brand of bottled water they're using or where they're getting it from.
Yeah. We're it's just commercial bottled water. We don't have a contract with any particular bottled water company. All bottled water has to be licensed and inspected by Michigan Department of Agriculture. I'm not sure, to be honest with you, if they require sampling for PFAS for the bottled water or not. I assume they do.
Yes, I'm pretty sure the answer to that question is yes, but I don't have that data for the bottled water industry, but I'm pretty sure that answer is yes. Lisa, I'm going to go back to you. How about shower heads and breathing in steam? I do believe that this could potentially be a problem, breathing in the vapors.
So, the amount of PFAS that's in water is in parts per trillion. So we're talking, you've got parts per million, and then parts per billion, and then parts per trillion, which is what we measure PFAS in water. So it's a very small amount that's in water. And to get the amount of PFAS where we would be concerned about breathing it in from shower vapors would have to be extremely high. So again, inhalation of PFAS from shower vapors is not a concern.
Because Lisa, I believe that the levels used for coming up with the health-based screening levels was based over a 30 or 50-year exposure duration for the lifetime of a person. Can you answer that?
Yeah, so the health-based screening values were developed to protect a person from in utero through end of life. So basically a whole entire lifetime. Yeah.
So
chronic long-term exposure.
Chronic long-term exposure. Thank you. All right. I'm going to throw this one out to the whole team. Does PFAS impact the ability to sell a home? Does a current homeowner need to have an alternate water source in place if PFAS levels exceed requirements before selling a residence? Anybody feeling brave?
Well, we have several other PFAS sites in District 10, and I know we have had several homes sell that exceeded the PFAS the MCL levels. So yes, you can sell a house if it does exceed the PFAS MCL. You are required to, as far as I'm aware of, you are required to let the future buyer be aware that of the high levels that you have. Is that going to affect the ability to sell a house? Yeah, probably it is. But it's a situation that we're probably, it's probably going to take quite a long time before we really have a long-term solution to solving the water problem out here. You're probably going to have a filter for a while.
Mhm. And there are, in cases where, you know, a homeowner wants to take a proactive approach, they could actually purchase a whole house carbon filter that could handle the PFAS filtering out of the water, or a reverse osmosis, or there's a couple of different types of filters that whole house filters that could be put on a home if somebody wanted to do that. Now they are expensive, but it is a solution. So if you're selling your home, you know, you could advertise that as a plus, that you have this system that could deal with PFAS.
Hey, Abby, don't mean to interrupt. Before you get to the next question, I see Christine Kosmowski has her hand up. Maybe she wanted to chime in on something there.
Chris, go for it.
Okay, thanks. Sorry, this is a little delayed, but it's in regards to the question about bottled water. So I'm with Michigan Department of Ag, and the food laws point to Eagle's law and rules. So a source in Michigan putting water into bottles will need to meet these new standards. So I just wanted to clear that up.
Thank you. Thank you, Christine. Perfect. Perfect. That's just what we want to hear. All right. The next question says, there used to be a tannery in Whitehall. Is it possible Whitehall's municipal waste stream could be contributing? While that's not necessarily related to this, but all of our wastewater treatment plants then have been contacted and are working through Eagle's different divisions to address any potential PFAS sources that they have coming into their systems. I don't have the specific information for Whitehall, but if there was discharges that were getting into their system, they would need to follow that upstream, so to speak, to an industry or to a discharge, so they could try to reduce those PFAS concentrations in their overall waste stream so that they could meet the discharge limit of, I want to say 12 for PFOS. And so that's a pretty, that's been a pretty limiting factor for a lot of our wastewater treatment plants, but they've, you know, for most of them, they've been able to do it. And it's really led to a lot of different investigations and opportunities to get PFAS out of their systems so that they don't have long-term issues down the road. So good question. How much change is there in the test from the work the EPA did in this area in the 1990s when they put the wells in? So we have a couple of people on our call here from our materials management division. And I want to say that Christine Matlock can take this question. Christine?
Hi, my name is Christine Matlock. I'm the project manager for the RECRO program, and we oversee the corrective action on Barbara Steele. I don't know if this is what this attendee is referring to, but I can tell you that all of the groundwater monitoring wells on the Barbara Steele property have been plugged and abandoned. So we don't have any current data from those wells, if that's what this attendee is referring to.
Yeah, and they would have not been testing for PFAS back in the 1990s.
That's correct.
Yeah, yeah. So, but you guys are still looking into any and all information you've got in that file to continue to compare it to what we're seeing, to see if there's any links that you can see through the data.
Yep. Yeah. So we did start a preliminary investigation after Peter notified us of the well that had the MCL hit in it, the Green Lawn mobile home. In the investigation currently shows that there is no evidence to suggest that Barbara Steele is responsible or contributing to the PFAS contamination. And this is based on the conceptual site model, groundwater direction, groundwater data, and then also just a history of their operations. But this by means no, we're still investigating. So, but right now there's no evidence to show that.
Okay. Thanks, Christine.
Mhm.
So the next question is, has information being sent to the local press, been sent to the local press about the situation to inform people outside the orange boundary that this meeting was being held tonight? In other words, was the greater public notified so that they could attend? Hearing through a neighborhood contact is always inconsistent. Peter, you can probably speak to how you were trying to get the word out.
Yeah, so the information was posted on, I guess, the various government websites, which probably most people don't check. But it was also posted on flyers around town. So I don't believe it was sent out as a press release, but we did try to notify residents through those means.
Yeah, but it was posted at the town hall. I think we were trying to get it out to even like grocery stores and something, as well as the MPART website.
And it was also on the village website, but perhaps to their point, good point here. If this expands beyond a more localized thing like it is, then maybe there's going to be increased outreach.
And I would say that if somebody's got a good way to talk with the neighborhoods in this area to let Peter know. So if there's a Facebook group or there's some other organization that everybody kind of checks in on, let us know, because we can definitely use them to help send out this kind of information so that we can actually get it to a broader reach of people. Okay, so we wanted to see the map, but I'm assuming this is the map. Maybe switch the maps to your next one, Peter, so people can see the dots again.
All right, just a second.
And then we have a question. Can you show the map where the testing sites were at? Thanks. I think this is the one that this participant wanted to see here. And then the question is to Peter, is drilling a deeper well an acceptable alternative water source?
So maybe the district health department might want to chime in as well here. Right now, we don't have a lot of information on where exactly the contamination is in the aquifer. We've looked at well logs of the houses that we've sampled, and there's only a handful of the houses that actually have well logs available. So it's a little bit hard to draw too many conclusions based upon the limited information. But in some cases, drilling a deeper well can be an option, but that'd be something we may need more information on, and that's permitted through the local health department, who looks at a variety of factors.
Mm-hmm.
Yeah, we really don't have enough hydrogeology information for this area to really make a decision at this point in time if drilling a deeper well is going to work. That is a possible option, but before we go down that road, we really need to know a whole lot more information regarding the aquifers out there.
Mm-hmm. So in an ideal situation, we would have somebody install monitoring wells at a variety of different depths to see where the contamination either tapers off or is non-detect, or where the highest zone of contamination is in that thickness of the groundwater table. So sometimes we'll have an aquifer that's 10 feet thick, other times we'll have an aquifer that's 100 feet thick, and that PFAS can be somewhere in that zone, and you kind of need to know where the highest level is so that we can give the information then to D10, and they can make a determination on where the drinking water well could be set safely so that you're not ingesting PFAS. But part of the reason that you see this map with the different dots is it could be that some of these wells are shallower or deeper than other ones, and that's why you might get a variation in concentrations, might be just due to the depth of the wells. But as Peter said, you know, well logs and records of when they were installed are not always easy to find. So we only have about half of the records to even tell us how deep these wells are for the residential wells. So it becomes a puzzle. We have to put all the pieces together. And so that's what Peter's still doing, is trying to put these pieces together to get enough of the puzzle put together so he can even figure it out. And we're really at the beginning points of that investigation to be able to do that. All right. I am not seeing him. Les, are you seeing any more questions?
I am not. Presently, there are no hands raised at the moment, and we have a question that's just come in from. We have a new question. You want to take it, Abby?
You've got a D10 will also announce this meeting on their website, on their Facebook page as well. So I think that twofold, they will help us do announcements in the future, as well as I'm assuming that they can help us post a copy of this meeting to their website as well. And
Yes, we'll make sure once the link is available that District Health Department 10 has access to it for posting.
Okay. And then there's some links in the chat for the YouTube channel, Eagle's YouTube channel. And then there was a clarification on the price of the drinking water sample. I said that Eagle's lab is available to do residential drinking water samples from private individuals. And it's $290 for a sample. So, but it is a do-it-yourself kit. You get the kit, you take the sample, then you mail it back, and then you'll get a professional lab grade result. And so there's a few things in there. So I would.
Hey, Abby.
Yep.
There was also a link in there. I'm sorry if you mentioned it already. There's also a web link in the chat for the Plume video that's on the Empire page. So that's if you're looking for that, it's also in the chat as well.
Perfect. Perfect. I'm going to go back to our panelists here. I'll start with Peter. Peter, any final thoughts that you'd like to share with the group?
Not really. I appreciate everyone who did tune in here, taking their time on an evening. Also, just want to reiterate, if you are within that sample area and want to be sampled, please contact me and we'll arrange to make that happen. And I guess lastly, if anyone, even if you're not in the sample area, if you have any questions or concern about this PFAS situation, please feel free to give me a call. Happy to talk.
Okay. Peter, while I'll go through some of the other panelists here, but if you'll put your name and number back up on your introductory slide, that might help people.
Sure.
Okay. Lisa or Bill Farrell, anything else from DHHS?
I'll just add that I can put my contact information in the chat in case anyone has questions related to health. I'm happy to talk.
Cool. Thank you. Thank you.
Yeah, thanks, Lisa.
All right. Anyone else on our panel want to, I don't want to have to call on each of you, but if anyone else wants to say anything else before we end for tonight? Okay. I really appreciate, as Peter said, we really appreciate everybody coming out virtually and joining us tonight to talk about this important situation. This won't be, we can certainly have additional meetings as we continue to gather more information into the future. But if you've got questions, feel free to reach out to Peter. He's going to be your best resources to start the conversation. If you've got questions specific to the Green Lawn Mobile Home Community, we've got some additional staff here, but you can still reach out to Peter and he can get you to the right resources. So we've got a whole lot of staff here willing to talk to you about your specific questions. So thank you again for coming. Les, do we have any other final housekeeping issues?
No, that's all. Just stay tuned for, just keep a lookout for that, the recording for the webinar, which may show up as early as tomorrow afternoon. And I think that's it. And just, thank you from myself and from Matt Tomlinson, who was co-hosting with me on Behind the Scenes.
All right. Happy holidays, everyone. We'll see you later.